The Tomah VA Medical Center says it continues to make changes in the way it treats pain following the 2014 death of a Marine Corps veteran. Representatives for the VA, along with state and local lawmakers, cited new initiatives and an increase in employee satisfaction rates as a sign that the system is improving. News 8's Mel Meyer joins us with more.
Lisa, following the death of the corporal who was under the care of the Tomah VA at the time, legislators were able to pass the Jason Simkoski Memorial Opioid Safety Act, which updated guidelines for the medical treatment of veterans. However, representatives at the Tomah VA today admitted that they have a long way to go and have yet to fully regain the trust of their patients. When Corporal Jason Simkoski passed away, his death sparked a massive investigation of healthcare practices at the Tomah VA facility.
We were told by VA staff it was probably a brain aneurysm, and later found it was not.
Since the veteran died from mixed drug toxicity, his family has been working with Congressman Ron Kind and Senator Tammy Baldwin to pass the Promise Act.
We want to help veterans lead normal and fulfilling lives, free from over-medication. Our family wants to make sure that other families don't have to go through what Jason went through.
The bill directed the Department of Veterans Affairs and Department of Defense to update guidelines for prescribing opioids for outpatient treatment and treatment of patients with post-traumatic stress disorder. White House Senior Advisor for the Department of Veterans Affairs, Jake Langenkugel, says that about 50% of veterans trusted the VA in 2014. Now that number is up to 72%.
I still look at that as not a passing grade. We need to get to 85 to 90% in the next 2 years.
Tomah VA Medical Center Director Victoria Brahm says that they have seen an increase in satisfaction with executive leadership, but it's only a small percentage of employees surveyed.
We can't do this if the employees and the veterans don't trust in us. So we know we're going in the right direction with scores like this.
Congressman Ron Kind says that with initiatives like Pain University, which provides courses for managing and treating pain, and other initiatives can serve as a model for the entire healthcare field.
Truth is that we as a nation have done a very bad job of managing pain within the healthcare system, and we have to do better.
At the local facility, veterans are able to take in a variety of traditional and non-traditional pain management methods, which was frequently cited during the meeting as something that could be replicated elsewhere.
Interesting. Now, are there any other initiatives in the works for the VA to help improve their healthcare system?
It was discussed during the event that veterans should have access to quality care when they need it, and that may include the VA guiding patients to outside healthcare in the area.
Okay.
However, that would be based on if they didn't have access at the local VA facility.
Okay. Thanks so much, Mel.